Welcome everyone to another exciting edition of NeuroConnect, our weekly live event dedicated to unraveling the wonders of neuroscience. Together, we gather to listen, learn, and support one another through the power of personal stories. Our event centers around the experiences of individuals who have faced the challenges of living with migraines. These stories are not just narratives, they are sources of strength, empathy, and hope. In today's event, we will first start by exploring a recent breakthrough, the newest novel of a drug approved in March 2023 for the treatment of migraine. Next, we will be joined by a remarkable guest, Dr. Hoda Ayadi, who will take us on a deeply personal journey through her experiences with migraines. So let's begin today's session by exploring the most recent groundbreaking medication aimed at treating migraines. So recently, FDA has approved Zavspret, which is developed by Pfizer. It is one of the first and only calcitonin gene-related peptide receptor antagonist nasal spray for the treatment of migraine in adults. So, FDA approval for Zavspret is grounded in two pivotal studies. These studies, which were randomized, double blind, placebo controlled, confirmed its efficacy, tolerability, and safety profiles for the treatment of migraines. So, in these studies, Zavspret outperformed the placebo in two key aspects. First, uh, freedom from pain, that is defined as a reduction of moderate or severe headache pain to no headache pain. And the second one was freedom from most bothersome symptom at 2 hours post dose, that is defined as the absence of the self identified most bothersome symptom. This pivotal phase 3 study, which was published in the Lancet Neurology, found that Zavspread showed broad efficacy by also demonstrating statistically significant superiority to placebo across 13 of 17 pre specified secondary outcome measures, including early time point endpoints, for example, 15 and 30-minute pain relief and return to normal function at 30 minutes. Return to normal function at 2 hours and durable efficacy endpoints, for example, 2 to 24 hours and 2 to 48 hours. Sustained pain, freedom, and sustained pain relief. On the 14th endpoint, achieving a return to normal function at 15 minutes post dose, the difference between Zavspread and placebo was not established. Therefore, in line with the trial statistical plan, the other secondary endpoints were not formally tested. According to Kathleen Mullin, an associate medical director at New England Institute for Neurology and Headache, migraines severely disturb daily life, and so he said for migraine patients the speed of an acute treatment is crucial. So Zavspread, with its fast absorbing nasal spray, provides an option for rapid relief. It's particularly valuable for those who cannot take oral medicines due to nausea, allowing them to return to normal activities promptly. So Zavspread was well tolerated in clinical trials. The most common side effects reported in over 2% of patients on Zavspread and more often than in the placebo group included taste disorders, nasal discomfort, vomiting, and nausea. So Zavspread should not be used in individuals with a history of hypersensitivity to Zavepepend or its components. as hypersensitivity reactions like facial swelling and urticaria have been observed in clinical trials. So that's it from my end on the new treatment option for the migraines. Now let's talk to our guest. So join me in welcoming my dear friend and my colleague at Innoplexis, Dr. Hoda Ayadi, who is the product owner of Ontosite at Innoplexis. She is the one who has battled migraines with unwavering strength, and she will be sharing her journey, the hurdles she faced, and how she found resilience in the midst of pain. Welcome, Hoda.
Hi, Deepa. Thank you very much for your sweet introduction. Thank you very much.
Thank you, Hoda, for joining our event today.
Thank you. It's my pleasure.
Yeah. So, before we begin the discussion, we encourage our audience to share their journey, their hurdles, their experiences, and how they have managed their migraines. And if they have any questions, please feel free to add into the comment sections. So, without further ado, let's dive in this journey together. So, thank you, Hoda, for agreeing to share your personal story with us today. And I would like to know, can you recall when you first experienced a headache?
Yeah, so as I said, it's a pleasure to have to be here, to be able to be here, and I'm always ready to share my experience because uh, I go through so much of trouble having these headaches. So in whatever way, maybe audience or whom can see me and they can relate their symptoms to me, I'll be happy to say that what has helped me, how was it, how was, what was my story, so that it's like a support, support group. So yeah, I would be glad to share that. All right. So you asked me uh, when my headache started. So it's very unfortunate for me. My headache started from my childhood. So I was, I think, 10 or 11 years old. Like we never think that a child that age can get headache, but yeah, mine started from that age. So it was so strange for my parents that my mom thought I may be joking or I'm just kidding with them. I just want their attention. So she used to give me vitamins and would say, "Have this, you will be fine." So I used to have, and I still would have headache. So I would say, no, that didn't affect me. My headache is still there. Please do something for me. So from there, they came to know that, yeah. So I am not just saying things to, grab their attention. It's actually there. Yeah. So it started from my childhood, and it's with me, my friend, till now.
Okay, so Hoda, how did you know that you have a migraine headache?
Yeah, so that time my parents, they took me to several doctors. We did MRI, we did CT scans, so nothing was wrong. And, so doctors, they just diagnosed it as migraine. So, you know, yeah, so it was maybe at some point migraine because I used to have lesser amount of headaches, but yeah, definitely now a lot of other types of headaches are mixed with it. Yeah.
Okay. So, Hoda, was it quick that this migraine headache was diagnosed, or it took some time for the doctors to identify what was wrong and why you were having these headaches?
No, Deepa. In fact, it was quick. So, because I did all types of tests that I could do that time. So, I just told you MRI, CT scans, I did my eye checkup. So, whatever could be related to, a child having headache, I did all those tests. And nothing was really wrong with me. Eyes were still, I sometimes think that maybe my eyes So every now and then I go to eye checkup to do eye checkup, and still everything is fine.
Okay.
Yeah, but yeah, they said that it is a uh, one of the reasons that they could easily say that it is a migraine is because both my parents are also suffering from migraines. So
Okay.
yeah,
So it was something in your family, and
yeah, I got the good genes. Yes, it is there in my family. Not only my parents, but also like so my mom's family. A lot of people, like my mom's aunts, and they all suffer from headache. My mom's cousin. So we all like headache family. Yeah.
so what is the frequency? Like, how often do you get these headaches?
This is a very good question, Deepa. So, to whomever I say how frequent I get headache, no one believes me. They think that I'm joking, or still people they think that I'm, I just need attention. Maybe that's why I'm saying that. But the truth is that every single day I have headache, Deepa. Every
Oh,
single day in the morning, either I wake up with headache, or after like 1 or 2 hours I definitely get headache. The days that I don't get headache and I'm happy, I sometimes jinx it, so I tell to my surrounding, all my colleagues and friends and sometimes my husband that I didn't get headache, and immediately in the evening it starts as if someone is waiting for me to name it. And they said, okay, we forgot to give her headache. So it immediately comes. Yeah, but every day, Deepa, I suffer from headache. I know you are also a migraine patient. I have heard from you that you also get severe headaches. Now, I'm sorry, you are asking questions, but how often do you get headache?
so I mean, yeah, even I have an migraine condition, but fortunately, they are not that severe, and I can actually manage them or control them with painkillers. And probably it's once a month or twice a month. That is what I am suffering from, but
Yeah,
not like you. You've been having it like on almost
every
like
day.
every day.
Every
That's
day. Yeah, I can say in last month only one day I didn't get headache, and that day was really a good day for me. So I was thinking maybe I'm becoming better. I don't know how I'm becoming better, but maybe I'm becoming better. But no, yeah,
okay. Okay.
but
Are there any specific triggers for your migraine headaches?
yeah, Deepa. Before I answer to this question, I thought you this question might be there in many people's mind that is it like migraine every day you get migraine. So I don't know. Sometimes I think some of my headaches are like exactly migraine nature, but some of my headaches are exactly it relates to your question that you asked now. A lot of things around me might be the trigger for the headache. So uh, really for us who have migraine, we have to understand that what are the things that trigger us. And for each person, Deepa, it's different. I think you may know now. uh,
Yeah.
so the things that may irritate me may not irritate, other people. So the triggers could be hunger. Okay, so if I am hungry, if little bit, some time passes, and if uh, I don't eat something, immediately after that I'll get headache. And sometimes now I talk about eating. This Chinese food that we have in India. It has monosodium glutamate, Ajinomoto. If the food has this salt in it for like enhancing the flavor of the food, immediately me, my mom, my father, so yeah, wherever, so we are like a Ajinomoto detector. If we get the headache, something must be there in the food. So we come to know about it. Yeah, so hunger is one of them. Sometimes people like us, they get hungry, and suddenly, as if the blood sugar, drops, we keep on eating sweets, chocolate here, sweet here. So these are not good, in fact. So if at such time that we are hungry, we need to, eat slowly, and that also little portions of food. We want to immediately raise our sugar level, so we overeat sweets. Whereas that's the worst thing for headache, because suddenly the insulin level, uh, hikes up, and that is one trigger for headache, the hike of insulin level. um, so I am very much sensitive to the smell of coffee. Some people, coffee actually helps them. It reduces their headache.
Yeah.
For me, my husband has to take permission from me. Can I have a cup of coffee? Can I sit beside you? I say, okay. If I don't have the feeling, that aura type, I say, okay, yeah, you can sit. Otherwise, go and sit the other side of the room. I should not smell it. Yeah. Chocolate, chocolate. Sometimes I'm okay to have chocolate, but like chocolate is a big trigger for me. If I have a bit sensation of headache, chocolate will definitely, increase it, and I will get perfume. Uh, uh, the smell, we migraine patients, we are very sensitive to smell. If we are in a place that, there are lots of other smells, we may get headache. So I have one or two maximum brands of perfume that I use, those only. Those are the ones that I can actually tolerate. Otherwise, the rest of the perfumes or sprays and all, that's not for me. I definitely get headache. Um Sudden excitement, anger, this, uh, uh, this will definitely cause headache for me. If I have sleep deprivation, I slept very late in the night, and I woke up early, I didn't sleep well. Yeah, that is another trigger for headache. Sometimes we are at workspace, we get stressed, whatever causes my heartbeat to increase. That's why the doctors gave, propranolol for migraine patients to, balance their heart. Maybe people, they may think that, why balancing heartbeat is important. Yeah, if the heartbeat changes, it will trigger your headache. So yeah, this is another one. Hormonal change, we know as ladies, we our hormonal change is always there throughout the month. Yeah, that definitely causes headache. And sunlight, loud. So I'm always running away from sun, except for the rainy season in India. Sometimes I ask for sunlight. But yeah, sunlight. And uh, the other one is loud noise, where a lot of people are talking loudly and noise is there. Yeah, these are all triggers for my headaches. A lot, long list of them.
Yeah, it's a very big list of triggers for you. It would be very difficult for you to manage with these things.
Yeah, because you cannot always control things. So you
Right.
go somewhere, you don't get the smells that you want. Your perfumes, people, they use different perfumes. So yeah.
Fumes, like you also have a trigger because of that. So is there any way like the essential oils helping you out to relieve your pain? Like in my case it works to certain
Hmm.
extent. So
Essential
does that
oils,
really help
those
you?
help you?
Yeah.
No, not for me. The smell of essential oils, it gives me headache. Yeah, that's why I say it's very different for each one of the migraine patients. They should understand what exactly it's different for everybody. So that's why wherever I go and they see that I don't find any solution for my pains, they say you should find what triggers. I say everything triggers my headache. So yeah, essential oils. But yeah, I used to use Zandu balm a lot. Now that's not essential oil, I know, but Deepa, using Zandu balm would help me a lot. Why? Because I use like one layer of that I used to put on my forehead and especially on my eyes. And people will say, "You're putting Zandu balm on your eye." I say, "Yeah," because when it burns me, I feel relieved. So, because I have something more than my headache. So it's a burning sensation that I
Something
feel
very
good.
unique.
Yeah. Yeah, but now I don't use that because I'm having some herbal medicines that it is needed that I should not use those um, some things like Zandubam, very strong. Yeah,
So, like, I mean, it's a very long list of triggers. Or definitely, it must be having a very major impact on your overall quality of life. So,
it does.
how you have been managing this? Have you ever had to miss your work or other important activities because of this?
Yeah, yeah, always. Yeah, always this happens. So yeah, so one of the things that the doctors they always say, and that migraine patients they have reduced quality of life, and yeah, that is true. That is unavoidable. So I remember, look at me as a child. I imagine that I am like 10 years old, 11 years old. My whole family has gone to a park, an amusement park. I remember that day. So my cousins, they are playing. They are just, running here and there, and I'm the one. The families they have they go usually for picnics and they put rug and they sit on it, so kids were playing in amusement park, running here and there, and like I was sleeping throughout on the rug, because I had bad headache. So my family, we used to go somewhere to, a little bit climb the mountain and just enjoy the view. I was in the car sleeping. So yeah, so this is my childhood. Now also, Deepa, yeah, but during my work time, sometimes I get headache. If it is manageable with medicine, I manage it. Otherwise, yeah, I need to rush home and take rest because, personality changes. Yeah, but yeah, it affects. Of course, it affects because having pain is not easy, especially going through it regularly.
Yeah. So, like you mentioned, you have been having this when you were of 11 years age. So, how you have managed your school and college life, and now you've been full time working for the organization and having and I mean handling different responsibilities. So, how you have been managing this?
Yeah, so I will tell you that I try everything. Uh, I have tried everything. Whatever people they say, I try that. Like from my childhood, my parents used to take me to different doctors, so they would prescribe medicines. Those medicines, some of the medicines they didn't have effect. Some of the medicines they would reduce my headache. So different timings during my life, I had several different types of medicines from different doctors, this doctor, that doctor. So yeah, they would reduce my pain, but eventually my weight would increase, or it would affect my mood a lot, because many doctors they also prescribe antidepressants and also. Yeah, it would affect me, so I didn't want to continue with it like for years. Okay, so because it especially affects the health of the person, the state of mind of the person. So I used to take the treatment, leave it, take the treatment, leave it. Now also, Deepa, I try to use like medications, painkillers. I try to take different painkillers. I think many may be aware of triptan family painkillers. So that's not also the same for every migraine patient. Some people, sumatriptan works on them, like, but for me, sumatriptan is not working. So, for some people, ergotamines they work. Yeah, for me, that also works sometimes. So it's like uh, different painkillers. Well, so I know now what is helping me. So I try to use that. Otherwise, I try different techniques like, because sometimes, see, Deepa, another point I forgot about trigger is when we sleep in bad position, our muscles, they get, contractile spasm is there. Okay. So, or there's a strain on the muscles, either back muscles. If our posture is bad, we are sitting, in a wrong posture at work, especially. the spasm is there, strain is there. This will definitely cause headache, and it will, from you will get headache from your neck. Okay, so uh, it's very much important that you do regular exercises. I have tried now, weekly I go and visit a physiotherapist and chiropractor to, and they have asked me that you should do your exercises, otherwise this won't have any effect. They are right. So regular exercises should be there to, ease up muscles so that you don't get the trigger at least. So
Okay.
uh, different things that I try. I don't go under sunlight, because I know I will get headache. If I go, sunglasses, we always try to prevent it. Try to get good sleep. This is something that everyone can try. Like sometimes, due to other things in my life, like I have to work or something, so my sleep gets disturbed. But it's not always. Okay. Uh, the things that can help is like sometimes people they send different videos through Instagram or any other social media group that how does see this method you can definitely use, like pressing acupuncture. Pressing this point usually helps the between index finger and the thumb. So pressing will help it. Pressing the tip of the toe, it will help it. So when I have headache, I'm at work, usually my hand is on my head and I'm just pulling my hair. So this will help actually, because it helps the blood circulation. So pulling the hair, massaging this part, back of the head here. So it affects. I mean, these are the things which help me. So always, or if sometimes I'm at home, I tell my husband to massage my head so that I can little bit relax. So yeah, these are the things which help me. I try everything. Sometimes they say that put a hot pack behind your neck and your leg inside hot water, like that didn't affect me, but yeah,
Yeah.
it may affect many people. So these are the things, small things I hear from here and there. I try to use those and just manage things. It's very difficult, Deepa, but
Yeah.
yeah,
It's
I
difficult.
manage. Yeah, yeah,
Yeah. So, Huda, you have a daughter, right?
yes.
So, like we know that many people say or they believe that pregnancy can actually elevate headaches. So, were you comfortable when you were expecting your child in terms of migraine frequency?
By the way, that is a myth. Deepa, pregnancy. I also took that myth. So many people, when like long back when we were married, and after a few years, they were saying, "Why don't you bring a child? If they say that in during pregnancy, at least you won't get a headache." So when I was expecting my daughter, I could get worst. Means I used to get the worst headaches ever, and that time is the time that you cannot even take the pain reliever, or the pain reliever is so mild that nothing works for you. That was the so now they say, so that time I talked to one gynecologist, and she actually told me, who said that it doesn't, the headaches reduce. In fact, the migraine patient, the headache increases during pregnancy. I said, I was misinformed, nobody told me that. But yeah, so I can say the first half of my pregnancy I had terrible headaches. I mean, still I was expecting like 4 to 5 months. I experienced after that, little by little, maybe because of the hormonal change, so my headache reduced. Till I was breastfeeding my daughter, headache was very less, maybe once in a month. That also not that severe, but again after that it started. So yeah, somehow I enjoyed some time having less headache in my life, but it's not that yeah, headache will go. For some people, like when my mom was expecting me, she didn't have headache. The whole 9 months she didn't have headache, but yeah, I had.
So it's
I had.
different for
It's
so it's
different.
different for everyone.
Yeah, it's not like you won't get headache when you. Sometimes people, they may even get worse headaches, so yeah.
So, how do you cope up with these challenges of daily life despite your migraines? Do you ever find yourself feeling angry or frustrated due to this condition?
Yeah, Deepa, I used to, not now. So I used to be really angry at God. Why this happens to me? Uh, after my severe pains, because before I get married, I used to stay alone, and it was, my parents were not in India, and it was very difficult for me to manage my headaches, and I was very much afraid of my headaches because sometimes the pains were so bad I had to be hospitalized. So I would always struggle with myself and the God. Why this thing should happen to me? Don't I deserve a good life? But now when I look back, or after having painkillers, or after passing the very severe headache, I used to sit and cry a lot. That see how miserable my life is. I have to get this much of headache. It's it's it was very sad. But I, throughout all these recent years, I learned something else. Now I'm very thankful, Deepa, for everything I have. And I am telling you with my whole heart. Okay. As you can see, I smile always.
Yeah.
Yeah, sometimes if I don't smile, probably I have headache. But I try to be positive because positivity is the key to everything. I'm not just telling that. This is how I'm dragging my life. And I'm always trying to search something which will help me. And I will find that one thing which will help me. If it is a new medicine or anything, I have promised myself, if something will make you feel better, I will study that. Okay, and I will do that. So anything which help me, I will try till I can. And I'm positive. I have family now. I throughout all these years I have done my bachelor's, my master's, my PhD. It was not easy, but I did that. This is who I am. Headache, I really tried to get rid of it. So till now it didn't happen. It's okay. And that actually made my personality. This is who I am, and I cannot change anything about it, but I can just, with my thoughts, I can just help myself go through it easier. And this has made my personality as I am now. So I'm really thankful to God. We have to be really thankful. Sometimes I say that thank God that I don't have other more troubles in life. Many people, they have different troubles. They have cancer patients, they have lost their dear ones, they go through difficult financial phase in their life. So everybody is having troubles. So what, this is all tests that it's on us in our life. I'm one of them. Doesn't matter. So I have to find how I cope with it, and I am doing that, and I will do that, and I will never get disheartened, because I learned love, give love, and just just have hope, and just be happy. That is one key to it. Yeah.
That's so true, and it's really and inspiring to hear these words from you.
Thank you, Deepa.
Yeah.
This is what
So
I really believe.
it's I mean, on one side it's sad to hear that you are dealing with daily migraines. I extend my heartfelt wishes for you to find even greater strength and resilience
Thank you.
to conquer this condition and the pain that you have been into.
Thank you,
And
Deepa.
enjoy a life filled with improved quality and well-being.
Thank you, Deepa. This pain really has made me stronger, and I'm glad for it.
Huda, we have one question from our audience.
Mhm.
Uh, what should a migraine patient avoid?
Yeah, so it depends on each patient. It depends on what you are sensitive to. So for me, for example, I know I'm sensitive to um, coffee, so I avoid that. Okay. Um, Dairy products. Many of us have been told that dairy products are not good for you. We can simply avoid them.
Yeah.
If I have, for example, this buttermilk, which you find. So nowadays, uh, I used to have buttermilk. Immediately, I would get headache. So I know this, dairy products or these things will give me headache. So I should avoid it. Whatever I told that will trigger, just avoid. So the triggers are different in different people. They should avoid that.
Yeah.
Sometimes something in your heart will tell, don't take it. Listen to that voice, because whenever I ignored that, I suffered. Yeah.
So I would have actually loved to continue this conversation, but we have to conclude today's session
Thank you,
due
Deepa.
to time constraints.
Yes.
So thank you, Hoda. Thank you for joining the event and
Thank you
sharing
very
your
much.
personal journey with us today.
Thank you very
Your
much,
story,
Deepa, for having me.
yeah. So your story should serve as an inspiration for all of us, and uh, that really demonstrates the resilience and the determination can actually prevail even in the face of chronic conditions like migraines. So
Yeah.
thank you for joining today's event.
Thank you very much. Thanks to everyone. Bye bye.
Bye. So, migraines can be debilitating, but as we have heard today, with determination and the right strategies, they can be managed. We hope this discussion has provided valuable insights into the world of migraines and how one can navigate life's challenges while living with this condition. So, as we conclude our event, let's carry these valuable insights forward, continuing to support one another and raise awareness about migraines and other chronic conditions. Thank you all for being here today. If you found this discussion valuable, don't forget to tune in next week as we navigate into mixed anxiety depression with Dr. Chinmay Kulkarni. Have a great day and take care.